Good afternoon and thank you for joining us. My name is Tina Thibault and I will be your moderator for today's briefing. Joining us today, the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Welcome, my first COVID briefing. I know, Dr. Strang, that you and Premier McNeil used to compare ties, and I am wearing my pink tie today in recognition of Pink Shirt Day and anti-bullying. Just quickly, Pink Shirt Day started here in Nova Scotia in the Valley at Central Kings High School. 2 students stood up for a friend who was being bullied, and the movement began. And just as they were protecting that student, we're here today talking about how we're continuing to protect the health of Nova Scotians. Protecting Nova Scotians through the pandemic is my top priority as Premier, both through continued public health measures, border controls, robust testing strategies, and the rollout of the vaccine. Dr. Strang and I have already met a few times, and I want to assure Nova Scotians that I very much intend to work closely with Dr. Strang. I will join him here in these briefings for as long as they are needed. In our first meeting, I told him that I'm a science guy. I value science and I value the public health advice. That comes first. But as Premier, I am also very much focused on listening to stakeholders and working with them on the economic recovery of our province. I talked to many Nova Scotians, and COVID-19 is still very much on their minds. There's certainly a lot of hope now that the vaccine is rolling out, but concern remains with continued cases and new variants. I know Dr. Strang will have an update on some concerning trends he's seeing with recently announced cases. We need to pay attention to that. Nova Scotia is in an enviable position, and we need to stay the course for a while yet. The vaccines have given us hope, but they certainly don't mean we can stop doing all of the things that have gotten us here today. The good news is we are well on our way with vaccine rollout. Dr. Strang visited the IWK clinic today for Nova Scotians over the age of 80. He'll tell you how that went, but spoiler alert, I'm hearing it went very well. In fact, Nova Scotia and PEI were the first jurisdictions to launch a community clinic. Nova Scotia has been recognized for many firsts during the COVID-19 response, and this is yet another one. When asked about the first vaccine clinic for seniors being held at a children's hospital, a clinic organizer noted, "These are our children's grandparents, and we need them to be well." Protecting our most vulnerable Nova Scotians has been our goal throughout the pandemic response, and it is fitting that it is also what is driving our vaccine rollout. It's also what the science tells us. Age is the biggest risk factor. By the end of March, 10 community clinics will be operating across the province, starting with those over the age of 80. This is a big effort, and we appreciate your patience. Today marked the opening of the first First Nations prototype clinic at Millbrook. We're supplying the vaccine, and the communities have taken on the leadership of organizing the clinics with the Mi'kmaq Health and Wellness Authority. Dr. Strang and his team are also working with the Health Association of African Canadians and the Association of Black Social Workers to develop a prototype clinic for African Nova Scotians. This approach recognizes that there are Nova Scotians who are disproportionately impacted by COVID-19. It's critical that we work together with vulnerable communities to ensure we can roll out the vaccine effectively. And with that, I'll turn it over to Dr. Strang for his update.
Thank you, Premier, and good afternoon, everyone. Premier, congratulations on becoming the Premier.
Thank you.
Welcome to the briefings, and I look forward to working with you on the COVID file through the briefings and others. Nothing personal, but I hope we don't have to celebrate 100 briefings like I did last Friday with Premier McNeil.
Definitely.
So I was at the IWK clinic today. I was very impressed, and I do want to give my thanks to the IWK for all their work. Thanks to the seniors who were showing up. I had the pleasure of meeting a group of nuns from Mount St. Vincent's who came together to the clinic. Wonderful ladies, and make their commitment to protect each other. They lived together, and they wanted to make sure they were vaccinated to protect each other. So wonderful kind of message there for all Nova Scotians as you get a chance to get access to vaccine. As the Premier mentioned, we are seeing 3 new cases today. This past week, our numbers have begun to creep up, and we now have 21 active cases as of today. Yesterday, we reported 3 additional cases of the UK variant, which brings the total number of variant cases of the UK variant cases in Nova Scotia that we've had to 6. I'm also becoming concerned about community transmission, as we are seeing several cases over the last few days with no clear link to travel or a known case. Many of those testing positive for COVID-19 recently have been socializing more with a broad range of close contacts. The good news is that people are by and large respecting the limits, and they're not gathering in large groups, but they are socializing frequently with different groups of people. Based on these patterns, based on the ongoing investigations, we do expect higher case numbers in the coming days. So it's important that we use this as an opportunity to remind ourselves that we are still in a pandemic. What my MOH has told me is that they're getting a sense that people are acting that we're even though we're talking about a pandemic, we're acting like we're not in a pandemic in Nova Scotia, and that's important that we remind ourselves that we need to continue to be cautious. I recognize that COVID fatigue is real. We've been at this for almost a year, but as tired as everyone is, public health measures are as important now as they were last March and April. So enjoy your friends, go out to dinner, and socialize in other ways. But I'm just asking people that even if you're living within what's required in the public health regulations, you need to go further to slow down your social activities, spread out the frequency, keep your social groups ideally to a single social group of no more than 10, and keep it consistent. We were in this place back in November, and I gave the same message. We cannot have people going out multiple times in a week, each time with different people. We need to still remain very cautious about our social activities, because it's social activities which is the main way that spreads this virus. So please, we are still in a pandemic. Still, even though there's signs of hope on the horizon, we really have the next 2 to 3 months that we need to stick with it. We've been at this for a year. We've done an amazing job, and Nova Scotians have answered the call. But please, we need all Nova Scotians to continue with what has kept us safe. We need to continue that for the next 2 to 3 months. We can't let up now. So please, especially being careful around how you socialize, who you socialize with, how frequently you do that. And if you have been at a social or other event where there are people from outside your normal family or close social group of up to 10, we are asking you to get a COVID test within a week of being at that event. And this is especially important if masks were not worn at this event. So that's on top of everything else. Now, if you've been at a social event, especially with people outside your normal social bubble, and especially if people haven't had masks, you need to be looking to get a test within a week of being at that event. If you have more than one single consistent bubble of 10 within your family or social groups, please consider adding regular testing to your COVID-19 prevention measures. And the greater the number of people you have close contact with, whether it's through work or social activities, the greater your risk and the more important and frequent regular testing should be. But if you only go out for things like once a week, say to get groceries, and that's the limit of how as you get outside your home, then you don't really need to think about regular testing. But if you are out and about, regular testing should be part of your COVID precautions, and the more you're out, the more people you're with, the more frequent your testing should be. We have made great strides, and testing is easy and accessible across the province. You can book a test at one of the primary assessment centres that are throughout the province, or you can get one of the pop-up testing sites that we have rotating through for various communities across the province. We have to remember, we are able to enjoy many things here in Nova Scotia that people in other parts of Canada cannot. But if we lose sight of the fact that we are in a pandemic and the fact that there are variants out there that are quite concerning, then we're in a position where we're likely going to have to be in a place where we might have to lose some of the ability to have those activities. So if you like doing what you're doing, be careful on how you do it, and hopefully we can get through the next 2 to 3 months. Before I go on to today's vaccine update, I do want to share some good news, though. Recently, last week, we talked about a cluster of 3 cases of COVID-19. One of the cases was at a school in Beaverbank. We have done extensive testing of the close contacts of that family, people in the school and the daycare, and of the 93 contacts that were identified, all of the tests except 4, we're still looking to identify those people, but all of the rest of the close contacts, their first round of testing was all negative. So that's good news to share, that a cluster that does not appear to have spread further from that. However, community testing in the Beaverbank, Lower Sackville area, and the general community testing has resulted in another positive case that remains under investigation, and we are waiting for some more results. So as a result of this increased case activity and the concerns we have about undetected yet community transmission, we are increasing our testing capacity and our access to testing in 2 parts of the province. In Lower Sackville and Beaverbank, we are in the process of establishing a primary assessment center, and the Nova Scotia Health Authority will have more details on this in a press announcement later today. And in the area, in the communities between Wolfville and Berwick, because we have some other cases in there that we're working to determine how they may be linked, and we have some concerns that there might be some undetected community spread. So in the communities from Wolfville to Berwick, we're asking anybody in those communities to get tested. There are primary assessment centers in Berwick and Wolfville, and we are mobilizing the public health mobile vans into parts of that part of the province in the coming days. So specifically focused testing in geographic areas is what we've done previously when we've detected concerning signs. We're doing that again, and it's important. It's what helped us robustly when to deal quickly with the Halifax outbreak. It's what's going to help us out right now. So we ask people in those areas to take advantage and go get tested in the next few days. Moving on to vaccine supply, and to kick off the vaccine update, I can tell you that we anticipate receiving 14,700 doses of vaccine, where we are receiving them throughout this week. And our vaccine supply is expected to be steady, with weekly shipments of at least 10,000 doses of the Pfizer vaccine until the end of March, meaning that we are on target to meet the outcomes for the first 90 days of our vaccine strategy. As both the Premier and I have talked about, on Monday, the first community-based COVID-19 vaccination clinic opened at the IWK for Nova Scotians who are 80 years of age and older. As we've talked about before, the goal of this clinic is to test the clinic operations and the flow with a small number of people and apply those learnings as we expand these types of community clinics. As I said, I had the opportunity to drop in at the IWK clinic, and I was again very impressed. Running very smoothly, lots of learnings coming from that, how we can make things better, but the clinics themselves are functioning very well. There have been no major issues or concerns identified, and some important, minor but important process improvements which are happening. And all those will be applied as we roll out in the coming weeks community clinics for Nova Scotians who are 80 plus across the province. Nova Scotians, so starting next week, Nova Scotians who are 80 years of age and older will be able to start booking as of March the 1st. We have letters now are this week starting to be mailed out. So if you're 80 plus and you're with an MSI card, you can expect to get a letter soon, and that gives you information about how you'll be able to go either through online or through a 1-800 phone number to book your appointment. For the small number of Nova Scotians who do not have an MSI card, for a number, whether there will be very few of those in the 80 plus, but as we roll this out for other ages, there'll be some people who don't yet have an MSI card, foreign students or some people for other reasons. You will have the ability to go through the 1-800 line, and if you're eligible, you're not just somebody passing through the province, but if you're here for a longer-term residency without an MSI card, you will be able to get immunized. The difference in these clinics is the letters that went out to the IWK clinic were less specific letters of invitation. That was simply for the prototype clinic. As people are getting their letters now, it's simply, they're not inviting, they're simply just giving them information about how the 48,000 people who are 80 years of age and older can get immunized. If you do not receive a letter, it may be that your, as I said, your information MSI is inaccurate, or you may not have an MSI card, and you will have opportunities. There'll be more communication on this about getting support through a phone line. I just want to remind people the clinic locations that will be open for booking on March the 1st and with vaccination starting on March the 8th. These are continuing at the IWK Health Centre, the Canada Games Complex Centre in Sydney, the NSCC Truro campus in Truro, New Minas Baptist Church, and there are 6 more locations that we are announcing today. The following 3 clinics will be open for booking on March the 8th, and then they'll be able to start immunizing on March the 15th. And this is and more details, not specific locations, but there'll be a clinic at St. Francis Xavier University in Antigonish, at the Halifax Forum in Halifax, and the NSCC Burridge campus in Yarmouth. And then the final 3 clinics, which will be open for booking on March the 15th, and their clinics will start March the 22nd, will be the NSCC Lunenburg campus in Bridgewater, and we're working for final confirmation, but there will be clinics in Amherst and a 3rd clinic in Halifax Regional Municipality. And you need to stress that people should not contact these individual locations. They are not able to schedule or make appointments, and that you have to use either the 1-800 line or the website. That you'll get letters, and there'll be much more communication on this in different formats. And people need to have an appointment. Do not come to a clinic without an appointment. It just makes the process much more complicated, and you'll have to go home and then book an appointment. We're also working on our first clinic, and it started today, our prototype clinic in our First Nations community. It was launched at Millbrook First Nations, and like we're doing at the IWK, we're using this prototype clinic to inform and improve the future clinics in all of our 13 First Nations communities. These clinics are being planned and will be operated by First Nations Health Center staff, physicians, and with the leadership and input of each First Nations community. The province and public health are ensuring that our role is to ensure the vaccine delivery, and we're working collaboratively with these First Nations communities to support their efforts as is identified and their needs. These clinics will start for those who are age 55 and older, as well as other people that identified as important knowledge and language keepers in those communities. The decision to start immunizing at age 55 recognizes that Indigenous communities, due to the impacts of systemic racism, may experience disproportionate consequences as a result of infections like COVID. It also recognizes that elders in the community play a very important role as holders of the language and knowledge keepers in their communities. And so for those reasons, in consultation and as requested by the First Communities, we are adjusting the age approach for our Mi'kmaq First Nations communities. We're also continuing to work closely with leaders in the African Nova Scotian community to determine how best to support access to the vaccine in these communities and ensure it's also being done in a culturally responsive way. And I do want to recognize the leadership and excellent work of members of the African Nova Scotian communities in response to COVID-19 that has been led by the Health Association of African Canadians and the Association of Black Social Workers. This work started in the spring with testing and controlling outbreaks in various of their communities, and we now continue that partnership with in planning for immunization clinics. We've had productive meetings about the vaccine rollout with these community leaders as recently as one earlier this week. We know that within the African Nova Scotian communities there is distrust of the health system for historical reasons, including mistreatment and racism when trying to get care. We have heard from community leaders that for these reasons there is mistrust of the vaccine in these communities. This is why it's so important that the vaccine be offered in a culturally responsive way that takes the lived realities of African Nova Scotians into consideration. So today I'm pleased to share that there will be a prototype vaccine clinic in an African Nova Scotian community at the end of March. We are working closely with community leaders to develop this prototype, and from there we will expand these clinics to other African Nova Scotian communities and support access to community vaccine clinics, as well as working with community leaders to address the vaccine mistrust. We will provide more information on this prototype clinic as the details are finalized. So as we close today, I want to return to what I said earlier. We are still in the middle of a pandemic. We are not out of the woods. When we see concerning trends, we have moved in with increasing testing to support the affected communities, and now is no different. We have and will continue to do so, but we need the help of all Nova Scotians. Each of us must remain vigilant. We must remain cautious and follow the public health protocols, keeping to consistent groups of 10 with limited social activities. Our vaccine rollout is going well, but it will take time to get all Nova Scotians vaccinated. We are still in a pandemic, and now is not the time to let up. We've worked far too hard over the last year to let that go now. So please continue to look after yourselves and to look after one another and your communities. The Premier and I will be back on Friday with more updates, and until then, stay safe. Premier.
Again, just a reminder, we'll take one question and one follow-up from reporters in the room first, and then we'll go to the phone lines in the allotted time that we have for today's briefing. We'll start with Shayna Luck from CBC. Go ahead, Shayna.
Good afternoon. Dr. Strang, you've told us a couple of times about the criteria for sending samples to be sequenced for variant testing, but we have so few cases here. Wouldn't it give us more information if we just sent all of our positive cases to be tested for variant strains?
We virtually are doing that. Following our protocol means up until very recently, all our cases have been travel-related, which means automatically they get tested. We recently sent off the cluster in Beaverbank, which I forgot to mention. Actually came back the results. They're not variant, so which is good news. But as soon as we recognized that little cluster, we said we need to get urgent testing on those cases. So we've got established protocol, but you're right. Given the numbers we have, that protocol essentially means everything goes and gets tested. Once we know that we have a cluster of connected cases and we've proven the first case is a variant, we may not send the next cases on because it's very safe to conclude that they're likely variant because their source was a variant.
And just on the African Nova Scotian prototype clinic, you mentioned starting up at the end of March. We are seeing the Mi'kmaq clinic start today. Can you talk to me more about why that's taking that amount of time?
That's simply where we're at with working with our African Nova Scotian communities. They don't have the same infrastructure. Each of the First Nations communities have a First Nations health director. They have some established infrastructure that it makes it easier to work with them to get clinics set up. It's just a process of working through identifying the leaders, identifying the communities, working through understanding what their needs are and how we support those needs. Just takes a bit more time, but they're equally important in our mindset about how we support our vulnerable communities.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead.
Good afternoon, Dr. Strang. I have a question that I'm hoping you can help shed light on. So, from my understanding and what you said today, that community spread means that happens, I guess, when cases have, when we don't know the source of infection for some of the cases that are coming in. I was wondering if there are other considerations that go into determining when we have community spread, and if that's the most essential thing that we look for.
So when we have cases, we look at have they traveled, or two things: have they traveled, or are they already been identified as a contact of a known case? In both of those situations, that if they're tested, they come positive, we know we can explain how they got infected. When we say that it's cases, or when we aren't able to get those ready answers, we have to say we're not certain where they got infected. That's why we often say the cases are still under investigation. And when we start to accumulate cases like that, it raises the concern that there might be community spread. We don't know for sure, but we have to always err on the side of caution. And when we get a number of cases like that, it really makes us in public health we get more anxious and that's why we bring in the extra testing to make sure that are we seeing other cases that we might have missed. We may end up in some of those cases and we've had these before, once you finally get to interview all the contacts, and often it's when you put together 2 or 3 cases and then you come up with, oh, that is now how we can explain from a single source that wasn't identified at the outset, how we can now explain several cases. But we always, as soon as we see this pattern of cases that aren't readily explainable from the very outset, we always have to think about, could this be local community spread? And we all along we always act early, and we act on the side of caution. And what we always do, and the way to do that is bring in lots of testing. And you start testing rapidly in that community, whether it's geographic community or otherwise, and that's how you detect early on other cases that may have no symptoms whatsoever.
Go ahead with your follow-up, Nabal.
Thank you. So you mentioned today that there are some lessons that you are learning from the prototype clinic at the IWK. I was wondering if you can expand a little bit more on that. For example, what are you seeing and what needs to be improved?
I talked with they have a process engineer there, just some simple things around making the flow of the clinics faster. Even some of the things they've learned between Monday and today, they're actually, they book a certain amount of time per patient. They're able to immunize people faster between Monday and Wednesday just by looking at simple things. I'll use an example. So they gave, they had people coming who were couples. They had booked their own independent appointments. They realized very early on that it made more sense if couples were coming together, you book them one appointment and immunize them both together. That's just one example of how things you may not think of from the outset, you learn. That's why we're doing these prototype clinics. Little things, which you put them all together, make your clinic much more efficient. We're also collecting feedback from everybody who's going through these prototype clinics. The one at IWK, we'll do the same at the First Nation clinic. Feedback from the people who are getting vaccinated themselves is always that we'll put that all together and say, how can we make it, whether it's issues around accessibility or just make it a more patient-friendly experience as they're going through the clinic, or something that may actually make our clinic more efficient.
Next, we'll go to Lindsay Armstrong from Nova Scotia.
Thank you. Dr. Strang, I'm wondering if you can tell us more about the process in our local labs to be able to identify the variant strains here.
So we're still in discussions. We're looking some opportunities to whether there's any federal funding to help support the cost of bringing in the type of laboratory machinery, reagents, equipment, etc., that you would need to do the whole genome sequencing here rather than sending specimens off.
Go ahead with your follow-up, Lindsay.
I'd love to know broadly, if possible, about how much cost it would take to be able to implement this locally. And I'm also wondering if you can say if there's a concern at all that there is about a month's turnaround time for these varying cases. I understand the same public health restrictions work for both, and we've been quite fortunate not to have many, but is there any concern about this month-long delay?
I mean, it would be ideal if we could get that answer much faster. But we all, once we have a case, it's a positive. Even if it was here locally, it would take several days to get that result back. You're right. All the public health interventions are the same. But the faster we could get that variant result, it would help our investigation. That's why we're exploring. I don't have all the details of the proposal. The lab is leading that. I'm involved with some other folks of what it would take to get that, and we're still working with the federal government on how we might move that forward.
Next, we'll go to Jennifer Henderson from the Halifax Examiner. Go ahead, Jennifer.
Good afternoon, Premier Dr. Strang. Can you tell me, Dr. Strang, this one's for you, how many cases in the Central Zone and the Wolfville-Berwick corridor have not been traced to either travel or a close contact? How many are question marks in those areas where you're setting up the community clinics?
So, as of yesterday, there was a group of 3 in that, what I call the Western Valley area, that may have had some links to each other, still to be firmed up, but they really didn't have any sources directly related to travel, or they were contacts of a known case. So that's why that part of the province, we've got 3 cases, again, as of yesterday, 3 cases which were concerning enough that we're bringing in much more testing, that from Berwick to Wolfville, if everybody who lives in that part of the province, please go get tested in the next few days. I don't have the same numbers in Halifax. We had a number of cases today. I haven't had time to get on top of them, but we have a few cases here. Just some results from today. Like I said, even though that cluster in Beaverbank, the family, there's been no spread, but then we have another test from the community, another case from the broader community testing in that part of the province, or sorry, in that part of the province, part of HRM. So we've had a cluster of 3. We still we didn't have a final determination of where that cluster came from, and then we now have another case under investigation. So again, we're not going to wait for a bunch of cases. We act very early on when we have these kind of question marks, and again, the first step is to bring in stand up much more easy access to testing and get lots of people tested.
Go ahead. Go ahead.
It's on the vaccine rollout, the distribution. You mentioned that we're getting more supply, at least 10,000 doses a week for the next 4 weeks in March. There's been some concern that the rollout has been slower here in Nova Scotia than in some other provinces at the beginning. I think I heard you say you expect to catch it up by the end of March and hit the target. Can you tell me how many people you expect will have received the vaccine by the end of March?
So I don't have that specific number in front of me. We can get back to you with that. I do want to make a comment on people saying that we're slow in Nova Scotia. That's simply because they're looking at the number of people who have a single dose. You have to remember that in Nova Scotia, we made the decision that we're going to hold back the second dose. Our focus is to get as many people as quickly as possible, get fully immunized with 2 doses of vaccine. And if you actually look at the percentage of the population who are fully immunized, Nova Scotia is close to the top. So if you only focus on the first dose, it gives you, I guess, an inaccurate picture. If you focus on number of people who are fully immunized, then we're right up there at the very top in the country.
We'll go to the phone lines now. We'll take a question from Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. Last week, when we asked you about the origins of the variant, you said that you really didn't know and you thought we were fortunate. Is there anything new that you've learned over the past week? Because personally, I'm still trying to wrap my head around the fact that it hasn't really exploded here. And are you seeing any evidence that perhaps it may well? I mean, our numbers are creeping up, and the way it's happened elsewhere, they have a few, and then bang, they have a big number. Are we on the verge of having a big number one of these days?
That's what we're working hard to prevent. I hope we're not. We had the initial case from a couple of weeks ago, the 2 cases of variant that we did a lot of testing around. No evidence at all that any of our recent cases are connected back to that. The cluster was in Beaverbank. We thought it might be variant. It turns out it's not, which is helpful. We do have the cluster up in the valley, which has a variant case as part of that cluster. So part of what we're working very hard to avoid that explosive situation, I guess, is the answer, Keith. And that's why we need lots and lots of people in both of these communities to come out and get tested in the coming days.
Go ahead, Keith, with your follow-up.
So have you any further thoughts on why we appear to be an outlier? Because obviously, I'm talking from a national perspective. It seems like the variant has taken hold in many other provinces, and it spreads rather quickly. It hasn't happened here. I'm just wondering, again, have you had time to perhaps think further about why that is?
Well, I think we've been able to limit the amount of variant or any kind of COVID that's coming into the province. And then when we do have cases, we're able to jump on them really quickly and do extensive investigation. I do think that that part of our success is, and this is what we need people to focus on, is that all the measures we ask people to do, which is stay home if you're sick, wear a mask, wash your hands, limit your social activities, all those pieces, they will minimize the spread of COVID-19, no matter what the variant is. And we know that the UK variant is much more, has a greater ability to be spread from one person to the other. Therefore, the importance of people to be very closely following all those COVID protocols. If everybody is doing those, that will help us minimize the spread, even if it is a UK variant strain. And so all along, we've done a good job in this in Nova Scotia. So I'd like to think, I don't have proof, but I'd like to think that part of what is helping us limit the spread even now is most Nova Scotians continuing to follow the COVID protocols. However, as I said in my remarks, as our most recent cases, we're starting to see evidence of people relaxing. Still within the letter of the law by the public health regulations, but there are too many social activities, too many different groups that they're socializing with. So we need people to slow down for the next 2 to 3 months. We need to still stay very focused on limiting our social activities, limiting the numbers of people, ideally only a single social group of 10.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I just want to be clear that I understand this right. There are 2 of the 3 cases today that are still under investigation, and 1 of the variant cases is still under investigation, it's not connected to travel at this point. So are you concerned about community transmission with the regular COVID virus or with the variant, or both?
With both. I mean, we don't have proof. It could be either. So our focus on is to get tested. We'll submit specimens for the variant strain, but the measures are what needs to be put in place, and what we need to continue doing it doesn't change whether it's the variant or normal strain that we're trying to prevent.
Go ahead, Natasha, with your follow-up.
Thank you. Premier, I'm wondering, I know our numbers are starting to creep up a bit, but I'm wondering if there's any thought right now to a maritime bubble potentially happening before an Atlantic one because of the current situation in Newfoundland, or have you even had time to consider that at this point?
No, there won't be a bubble. Obviously, we have still some travel with PEI, but at this point, we're going to stay the course, and the approach has worked. Out of abundance of caution, I'll quote Dr. Strang in that approach, and making sure that we have our restrictions in place. Obviously, being very mindful with what's happening in Newfoundland and other provinces that are near to us, and I think that approach has proven to work so far, and we need to make sure that we continue to stay the course.
Next, we'll go to Elizabeth Mcsheffrey from Global. Go ahead, Elizabeth.
Hi there. My first question is for Dr. Strang. Now that this is going to start opening up shortly to community, and in particular with some younger populations in Mi'kmaq communities specifically, can you tell us a little bit about what's within the normal range of reaction to actually receiving the COVID vaccine? Should people who are working prepare to take the next day off? Is everything from a sore arm to nausea common? Can you just tell us a little bit about the experience of people who have actually received the shot?
So we know 2 things. We know from the clinical trials that these vaccines, like other vaccines, can create what we call a local reaction, some redness, swelling, tenderness, pain at the site of injection. There's no reason for, that's not unusual, and those are totally expected. There's no reason for people to expect that they're going to need a day off work or a day off school after they get vaccinated. We do have a process in place. In Nova Scotia, we participate. It's a national, what we call an adverse event following immunization, or an AFI, where there's a whole process for anything that's anything that happens to somebody's health shortly after being immunized that is severe or unusual is required to be reported from a healthcare provider to local public health. We do an assessment, then that information gets passed along to a federal level, who are getting information from across the country. What we've seen so far with both Pfizer and the Moderna vaccine is there's been no what we call a signal of something unusual happening with these vaccines from a safety perspective. And all the clinical trials would say that these are very safe vaccines. But I think people should be reassured that we have a robust mechanism for detecting and reporting and doing an overall assessment of the rates of severe or unusual adverse events after immunization with these vaccines.
Go ahead, Elizabeth, with your follow-up.
My next question is for Premier Rankin. Manitoba has had discussions about vaccine immunization cards being available to residents. I'm wondering if you've taken a position on that or whether those discussions are underway in Nova Scotia.
Sorry, what was the question around residents? I didn't get that.
Sorry, the question is around issuing immunization cards to residents who have been vaccinated. Manitoba is taking that approach. I'm wondering if that conversation has been had here.
It's Dr. Strang. I can answer that one. And we're working. We're encouraging people to use the Can Immunize app on their phone. You can download it. And we're using the Can Immunize clinic registration. So if you're immunized, you can actually have that information on your Can Immunize app. You'd also get the IWK clinic. There are still some people bringing their yellow paper vaccine cards that we've had for years. I didn't realize we still had those, but some of the seniors had them. So people can certainly have, whether it's paper or on their phone, their own personal record. We're not planning on giving out specific proof of immunization cards. I think that discussion has been based on should we have a vaccine passport, and if you're vaccinated, you can maybe be exempt from certain of the COVID protocols. It's premature to do that because we still don't know that there's not definitive proof that the vaccines prevent people from being asymptomatic transmitters. We know that they're very effective against preventing clinical and symptomatic illness, but we don't know yet whether they prevent the asymptomatic transmission. So for the time being, we need to treat, even if you're immunized even with 2 doses, you still need to follow all the other COVID protocols. So there really is no role at this point in time for any kind of a vaccine passport.
Next, we'll go to Victoria Walton from the coast. Go ahead, Victoria.
Thanks. This question is for the Premier. You said kind of in your intro that you're a science guy, but you also value opinions of your stakeholders. And I mean, we know here in Nova Scotia, a lot of different stakeholders for COVID, whether it be travel related, whether it be different residents wanting different things. Is there anything here that you see changing that McNeil had done differently that you're looking forward to changing with regards to COVID restrictions or protocols?
Nothing specific. I think we just need to make sure we have an open door to stakeholders when they bring information forward. There could be different information that we haven't looked at or considered, some type of business that's operating in a specific way where they want to bring it forward. It's continuing to be, I think, a fluid discussion and making sure that we do value that input. But the approach has worked, and I do agree that when there's an issue that we have to be very quick to shut down or add restrictions and then be cautious when we open back up. Right now there's concerns around other provinces and variants, so it's really important that we do stick to the science. So we'll be working very closely with our daily calls, and I'll be watching that very closely alongside Dr. Strang.
Go ahead with your follow-up, Victoria.
Thanks. This next question is for Dr. Strang. You mentioned that people are relaxing a little bit, and I'm wondering at what point you'll consider tightening rules again. If people are going out and socializing, should restaurant owners be worried that restaurants are on the verge of shutting down again?
We're going to work really hard to avoid that. I mean, that's, we're very early on. We're seeing some concerning early signals. Hopefully people listen and adapt their behaviors, and we aren't put in a place where we have to mandate behaviors by changing the restrictions. So, but we will continue to monitor the epidemiology. The next week or so is going to be very important as we watch that collectively. But as we've done all along, if there's a need to be stronger, I won't hesitate to bring recommendations like that to Premier Rankin.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, Dr. Strang. As you may already know, your colleague on Prince Edward Island, Dr. Heather Morrison, has suggested that an Atlantic bubble could be back in place by April. What would you specifically need to see in the epidemiology before you'd give the green light to reestablishing any sort of bubble across the 4 Atlantic provinces?
Well, I think we'd have to be where we were when we had the bubble, which was little to no community transmission in any of our provinces. We don't have restrictions for people coming from PEI. We continue to look at New Brunswick and Newfoundland. Newfoundland is very much still in an active outbreak. New Brunswick has been able to shift down to all of their regions are at orange level, but part of their requirements in their orange level is they're advising only essential travel even within the province. So we've looked at this. We'd have to have New Brunswick even at their yellow zone to taking a further decrease in risk before we could even consider opening up, removing the 14-day quarantine with New Brunswick. But with 2 of the 4 provinces still with significant levels of COVID activity, it'll be a while before we're able to be at a place where we're all comfortable enough to be able to even consider bringing forward a recommendation to the premiers about reconstituting the Atlantic bubble.
Go ahead, Jean, with your follow-up.
So given all that, how likely is a fully restriction-free reopening to the rest of Canada, and when might that happen? I know I'm asking you to look in a crystal ball, but your thoughts on that?
So you are asking me to look in a crystal ball, and it's I think we're even further away from that. We still have substantive, even though it's coming down, we have substantive levels of activity in a number of other Canadian provinces. We still have this concern about what's going to happen with the variant and how predominant will the variant be, and will that create a resurgence of COVID in the next few weeks or into March or even April. So there's a lot in the short term that we have to get through, Jean, before we'd even consider where we might be. And my advice when I talk to business, tourism, a lot of other folks ask me similar questions. I say you're best to err on the side of caution and expect to be having to live with substantive types of COVID protocols, including border restrictions through the summer and into the fall.
We have time for a few more questions. Lindsay, do you have another question?
I'm wondering about the progress of updating our vaccine transportation plan to be able to bring Pfizer vaccines into long-term care homes.
We've looked at that. It's Pfizer is because of the ultra low frozen, it'd be very challenging to bring that logistically into long-term care facilities. So right now we're not looking at doing that in the short term because we're anticipating that fairly soon we're going to have a return to the usual or expected Moderna supply. And it doesn't make sense to do all the work just for that short term. If, however, we have a longer term delay and a longer term reduction in Moderna vaccine, we've already got people looking at it, but it wouldn't be efficient to do it now if there's a short term. But if the Moderna supply is challenged for the longer term, we will look and we will have to start to turn to using Pfizer vaccine in our long-term care facilities.
Shayna, did you have another question?
Dr. Strang, we've been seeing a slow, steady increase in cases. At what point would you feel confident to say that what we're seeing is a third wave?
We're nowhere near yet. I need to see. These are early. The last couple of days, my team in public health, they're doing the assessment of these cases. One of them, there's a household cluster of 3 cases. So those are 3 cases, but you consider them really one source. So we need to understand a lot more of the cases we have in front of us right now. See what what happens over the next few days and weeks. I'm not prepared at all to speculate if and when we might see we call this a third wave. We're still in the second wave. We had a resurgence in Halifax in November. If we do have it wouldn't be totally unexpected to have another resurgence still within the second wave. A third wave to me is something when we know we're out of the second wave and we've been there for a period of time, and then we get the recurrence of the of the virus.
Nabal, did you have another question?
Dr. Strang, so the B117 variant, we heard that it might be more virulent and it might be more easily transmissible and more severe when people get sick with the variant. So I'm wondering, is the severity of the disease with the cases that we've seen here, how has it been? Have people been very sick? Can you provide any information on that?
No, we're still seeing relatively mild disease. everything I've seen is that the variant you're talking about, we call it the UK variant, it doesn't produce more severe disease. What it does is it's much more transmissible, but it doesn't seem to increase the level of severity of disease. I mean, that's the variant which Newfoundland is working to control right now, and by and large they're having very mild, often asymptomatic disease with that variant. It's more the transmissibility which is the concern with this variant.
Jennifer, did you have an additional question?
Just a quick one, please, if you don't mind, Dr. Strang. Has Nova Scotia signed on to the Panorama electronic reporting system that the federal government is using to sort of aggregate statistics about who's...
Absolutely, yes. We were the first province to actually implement Panorama in its cloud-based format several years ago. So we've had Panorama implemented for, I think it's going on, to over 2 years now. And other provinces had it, but we were the first to do it in a cloud-based with all the components of Panorama. So we've been a leading province in Panorama. That is exactly what we're using. That all the information from individual vaccine records, we'll be tracking all that through our Panorama. So we're a leader in the country in the use of Panorama on vaccine on assessing vaccine coverage with COVID vaccines.
We have time for one more question. Keith Doucette, do you have a question? Elizabeth Mcsheffrey, do you have a question?
Yes, I do. Dr. Strang, I just wanted to make sure I was clearly understanding what you said earlier about the community clinics for people age 80 and above. So as I understand it, letters are going out to the public, but they're not invitation letters, they're information letters. So those folks will have to book their vaccines themselves. And so my question is, if I'm understanding that correctly and those letters are to help people book themselves, how will you avoid overwhelming the system with folks who are trying to book vaccination?
So part of that, they'll be given information that allows them to, that they have to then provide it's based on their age, their MSI card. If somebody goes in and tries to book an appointment and they're not the right age group, they won't be allowed. They just can't. The system won't allow them to book. It's scheduled appointments, so we can control the flow of people throughout a day and the number of people for any given day at any of these clinics. So I don't see us getting overwhelmed. And as I said, the system, that is why we're using the MSI database, which automatically has people's age group in there, and that's an automatic barrier. If somebody tries to get past the system and they're actually too young to be eligible yet, that the system will just simply not allow them to make an appointment.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. In recent months, I talked to many Nova Scotians, and COVID was on everyone's mind. There's certainly a lot of hope now that the vaccine is rolling out, but concern remains with continued cases and new variants. We need to continue supporting public health measures to protect Nova Scotians. That's why I really want to thank everyone involved in the response. Dr. Strang has said many times he is just the face, and there is a giant team behind him. My thanks to all of you for your efforts. I know it hasn't always been easy. To Nova Scotians, I want to say, hang in for another 2 or 3 months. Your actions, your commitment, your caring are what has gotten us to this point. As your Premier, I will do everything I can to support you, to support Dr. Strang and the entire response team, and support a strong and healthy economic recovery. Thank you.